Mandatory COVID vaccinations in Australia. Let's have a look. Hello everyone, Florian.heise here, and welcome to another episode of HeiseSays. Grab your stein of coffee and let's have a look at this article from news.com.au, which is discussing, well, the potential for almost or mandatory vaccinations here in Australia. Now, before we get into this article, because it is going to be a very sensitive topic, I am not an anti-vaxxer. I think vaccinations are among the best inventions that have ever helped humanity. You know, all my children are vaccinated. You know, I get vaccinations. I only have one friend that has ever had a dramatic side effect to vaccinations. He actually had a issue with a vaccination. It caused swelling in the brain, and it led to him becoming legally blind. Now, he is still a proponent of vaccinations. He's still a proponent of it. People argue that there are all these toxic things in it. Well, you have to understand that when vaccines are transported, you know, the cultures that they're in, they provide a fantastic basis for bacterial growth. And if you were to inject bacteria into your blood, particular ones, you could get blood poisoning and die. And sadly, that's how people learned about it in the past. So that's why they have these toxic substances sometimes put in there as an agent to kill the bacteria. An amount that is so minuscule, it will have absolutely no effect on you, but can stop a bacterial growth. That is the point of it, everyone. We ingest a lot of toxic substances all the time. We're reasonably robust as humans. You know, just look at all the people that are smoking. Look at how much rubbish they take in with every puff, and then they'll argue about a tiny amount that's providing a antiseptic benefit to a substance. So I'm not too worried about that. The one thing that does concern me, is rushed scientific process, cutting corners, and a mad hysteria driving people thinking that the world is coming to an end, maybe cutting some corners or pushing something out too fast. If you look back through all of the historical disasters in medicine, and there have been many, and they are quite shocking, a lot of them has to do with either incompetence, rushing things out, honest mistakes, or simply some governments or some organizations allowing something to continue when others have already banned it. We can see that around the world. And this is where I would argue that the state should not have the power to force people to consume or take a substance or take any medication against their will. It should be up to the individual to have that right. I would say it's a violation of the non-aggression principle. And then if you force people to take, you know, a vaccine or to take something and inhibit their trade, that is surely going to, well, there's historical precedent, there's religious precedent and warnings about such things that people are going to jump on board. They're going to be very concerned. So what do you think here? And coming from Scott Morrison, of all people. So let's look. The coronavirus vaccine. Scott Morrison announces free COVID-19 vaccines for Australians. Prime Minister Scott Morrison said he intends to make a free COVID-19 vaccine as mandatory as possible once it's available. Just the terminology of that. Prime Minister Scott Morrison says he intends to make a COVID-19 vaccine as mandatory as possible for all Australians once it becomes available. News.com.au revealed today that the Morrison government has confirmed a landmark agreement with drug giant AstraZeneca to manufacture one of the world's most promising coronavirus vaccines currently being developed by Oxford University researchers. And I mean, people, you know, those of you that are making an argument, oh, it's a fantastic way to make money and to generate money for these organizations. You know, there are much easier ways to just milk money out of people these days. Just look at your mobile phone, look at the number of people that are addicted to in-app purchase and all this rubbish that you can make, which is much easier to milk money out of us. If it's proven safe to use, Prime Minister Scott Morrison believes the agreement will ensure Australians will be among the first countries in the world to secure the jab, revealing this morning it could be available to Australians as soon as early next year. The UK government has already ordered 100 million doses. Now, maybe it's just because of all of these horror movies or computer games I've played where, you know, it's the Atlas Corporation, or it's a revolutionary new vaccine, or The Last of Us, or what is it? That movie with I can't remember. You know what I mean. This just sounds like the plot out of a Hollywood post-apocalyptic movie, how the world came to an end. Yeah. Asked whether the vaccine will be mandatory, Mr. Morrison told 3AW's Neil Mitchell that it needed to get to about 95% of the population. I would expect it to be as mandatory as you can possibly make it, the PM said. Now here we go. Here's another solution. If you want to get 95% coverage, I've got a way to do it. I've got a way to do it without making it mandatory, without putting the foot on someone's neck. Really easy. Let me know. I'm going to have a shot of coffee. And let me know if you can think in the comments of what this revolutionary idea would be. Have you thought about it? I'll bring an example here. One of these things. Pay people. I know this is fiat, I know you don't like it, but pay people. Pay people to do it. Simple. Don't punish them. Don't make it punitive. Pay them. So long if there's evidence that it's safe, if there's evidence that it works, and you want to stimulate the economy. I mean, come on, you're printing money out left, right, and center. Pay them. If would you take it? If you're on the fence? If they pay you $500, if they pay you $1,000, and if they ensure that you can sue the state for any legal liability or compensation, would that alleviate your risks rather than mandatory? What do they care? They're getting mountains of debt for stupid stuff anyway. Why not? And they want to stimulate the economy. There you go. But you know what they'll do? It'll be punitive. It'll be punitive. You won't get access to this service. You won't be able to borrow a library book. You won't be able to fill up your car with petrol. You won't be able to drive. You won't be able to enter a shop. Oh, and then it'll combine with all this surveillance technology that we have, facial recognition and central computing. It is a dystopian nightmare that this world could go into. And what can you do about it? Well, at the very least, take a stoic mindset and bear it. Bear it. Like those happy ones in the gulags in the Soviet Union, some of the happiest people in the world. There are always exemptions for any vaccine on medical grounds, but that should be the only basis. Well, here's the thing. I mean, you've got the flu vaccine every year. I can't be bothered, for me to get it, it's more of a pain in the ass to go to the doctor, do all the things, make the meetings, then pay the fee or whatever, than it is to just stay at home and not get sick, to take the risk. We looked at this morning at the number of people that have recovered. Shouldn't that be our choice? Do we want to live in a state where the state has that power to dictate this onto people? Are we gonna hear all the the lefties rile up? I mean, we're talking about a pandemic that has destroyed the global economy. No, Scomo, you're wrong there, mate. You're wrong. It hasn't destroyed the economy. The interventions by governments to try and mitigate the spread of this illness has destroyed the economy. The pandemic hasn't. It hasn't. The global economy has taken the lives of hundreds of thousands all around the world and over 450 here in Australia. Yeah, 450. And how many have recovered? How many have recovered? We looked at it this morning. Everyone. We need the most extensive and comprehensive response to this to get Australia back to normal. However, in response to suggestions that would be there would be community resistance to mandating it, Mr. Morrison said the government had not yet made a firm decision that this would be made once the medical issues about the vaccine were known. Mr. Morrison said we'll take that issue when it presents, when clinical trials are finished, and we have to understand what the medical issues potentially might be. And that's why we'll take advice on its application. But I'm certainly open to that suggestion, but that is not a position that the government has taken. Mitchell pointed out that there would be a campaign from anti-vaxxers, but the Prime Minister seemed unfazed. I'm used to that. I was the minister that established the no jab, no play, he said. My view on this is pretty clear and not for turning. A vaccine holds the key to life returning to normal for millions of Australians, and the hope that international travel can resume in the future after the nation's borders were closed earlier this year. So you can see what happens. Travel will be restricted for people if you don't have this little tag on your passport. Or even better, they'll do that tattoo that you can't see. Maybe they'll put it on your forehead. While Mr. Morrison cautioned that more work needed to be done to prove the vaccine was safe to use, he told news.com.au the government will fund the rollout of more than 25 million doses to cover every Australian as soon as the drug is available, which could be next year. The Oxford vaccine is one of the most advanced and promising in the world, and under this deal, we have secured early access for every Australian, Morrison said. If this vaccine proves successful, we will manufacture and supply vaccines straight away under our own steam and make it free for 25 million Australians. However, there's no guarantee that this or any other vaccine will be successful, which is why we are continuing our discussions with many parties around the world while backing our own researchers at the same time to find a vaccine. Well, here, what if it is successful and then you get a mutation? Isn't there's a flu vaccine every year? There's a flu vaccine every year. So then, well, okay, guys, who do we need to buy shares in if this is going to be rolling out every year? I mean, come on. In a letter of intent with drug company AstraZeneca to supply the University of Oxford COVID-19 vaccine candidate to Australia, medical manufacturer Becton Dickinson has also been engulfed in the supply of millions of needles and engaged for the supply of millions of needles and syringes. The letter of intent covers vaccine development, production in Australia, and distribution with a formal agreement including the price of the vaccine to taxpayers to follow. However, it would be provided to all Australians free of charge. Well, it's not free of charge. We'll pay for it in taxes. Don't worry, guys. Nothing's free. Free from government is impossible. We pay. We will pay for it in our labour at one point. Don't ever think anything from the state is free. It just means your future labour or your children will pay for it. Mr. Morrison said he was also working to ensure early access to the vaccine was secured for countries in our Pacific family, as well as regional partners in Southeast Asia. So how it works. The Oxford vaccine is made from a genetically engineered virus that causes the common cold in chimpanzees and is known as something I'm not going to pronounce. Scientists have altered the virus to make it mimic the coronavirus and ensure the immune system can learn how to attack it. It does not involve injecting COVID-19, but a virus that looks like the virus to trigger an immune response. Here's a question. If you have had the virus and you've overcome it, if you're one of the people that's gotten sick and have overcome it, will you still be forced to take the vaccine? There's a question. What do you think our bureaucrats would say? Recent trials involving 1,077 people showed promising signs that it can trigger an immune response, but further trials are underway. The preliminary data shows that it is safe and induces a strong antibody response in all vaccinated volunteers, suggesting that an effective vaccine could be within reach, Oxford University's Rebecca Ashfield said in July. This trial was the first time that the vaccine had been given to humans. 543 healthy adults aged 18 to 55 were vaccinated with a single dose of this. A further 534 were given a control vaccine that gives similar minor reactions, including injection, site redness, and mild pain. Volunteers are having their immune response, both antibodies and T cell levels, monitored for at least 12 months, and will also be observed to see whether or not they develop COVID-19. The preliminary data from the trial clearly demonstrates that the vaccine induces an antibody response within 28 days. This response is in a similar range to that in individuals who have recovered from COVID-19, providing encouragement that the vaccine will be able to protect the majority of people against infection. But aren't we hearing as well that some people can get it again? This is the thing. You get so many different sources of news. During the trials, 10 volunteers were also given a second booster dose to the vaccine, which increased the antibody response to even higher levels. Well, have you exposed anyone to COVID-19 to see if it was going to work? I mean, I know we can't ethically do that. You can't ethically do that anymore, guys. They did back in the day. Oh, boy. You look into medical history, some of the medical treatment and tests and things they did, it was horrific. Medical ethics was just completely out the window. So this is why you have people a right to be skeptical, particularly when things are mandatory. Some of the testing they did was just shocking. Importantly, the vaccine demonstrates an acceptable safety profile with no vaccine-induced severe adverse events. There is no major side effects, Dr. Ashfield said. But annual booster shots may be required. Booster shots may be required for mortality under 2%, and the majority of that in the upper age levels. Maybe the booster shot should just be when you get over 80. How about that? for everyone. Scientists working on the vaccine believe that one dose may not be enough to protect against the infections. My personal prediction, based on decrease in antibody levels in individuals infected with other types of coronavirus rather than data from the current vaccine trial, is that we're likely to need yearly boosters similar to annual flu jabs, Dr. Ashfield said. Yeah, but how many people get flu jabs? How many people need it? Am I the only one that can't be bothered? Let me know, guys. Am I the only one that finds it way too much of a hassle and just gets the flu? I guess it's because I'm young and I still think I'm invincible. But, when you're older, I think my mother gets it. I think she doesn't even bother sometimes. Deliberately infecting people with the virus may be possible in future after careful consideration of the ethical implications, but is not currently allowed. A second trial has been launched involving 10,000 UK individuals, focusing on health workers, and other trials are being conducted around the world, including in Brazil, where rates of infection are high. The expanded UK trial will include children and older adults to estimate vaccine efficiency in these age groups. Immune responses in people over 70 are often lower than those in younger adults, she said. Hundreds of volunteers have sought for vaccine trials in UK and South America. More than 100,000 people have already signed up to take part in trials of COVID-19 vaccine. It follows earlier trials with mice and rhesus monkeys. Significantly, the vaccinated monkeys were protected from severe disease after they were challenged with a much higher dose of SARS-CoV-2 than humans would encounter through natural exposure. The volunteers in the current trials will be given a placebo dose or the vaccine and then be asked to visit a hospital or other research site to test their response over the next 6 months. COVID-19 jabs are to be manufactured in Australia. Some of Australia's most experienced scientists and pharmaceutical experts have been brought together to provide advice on acquiring safe and efficient COVID-19 vaccinations. The COVID-19 Vaccine and Treatments for Australian Scientific and Industry Technical Advisory Group held its first meeting this week with Professor Brendan Murphy, Secretary of the Department of Health, leading the group. On Sunday, Health Minister Greg Hunt confirmed he was in the first stages of negotiations with the manufacturer to produce the drug with AstraZeneca. From early on, Australian officials, led by my department, have been meeting with developers and manufacturers of a number of promising vaccine candidates, both domestic and international, over recent months, he told news.com.au. We are confident these actions and targeted investments will put us in the best possible position to secure early access to safe and effective vaccines for Australia. In April, the University of Oxford announced its partnership with the AstraZeneca that will see the organisation work with global partners to ensure the vaccine is available around the world, particularly for low and middle income countries. Both universities and the pharmaceutical giants are working on a not-for-profit basis during this course of the pandemic. Any royalties the university subsequently receives from the vaccine will be reinvested directly into medical research, including new pandemic preparedness and vaccine research centre. The centre is being developed in collaboration with AstraZeneca, Oxford University said. Now, here's the thing. If they make this mandatory and people go, I'll refuse, there'll be a line. There'll be a line when people, will jail be that line for some? Will you go to jail otherwise? Will they strap you down and force you to take it? What if they say that you're exposing your own children to an unsafe environment and take them away? That was a very effective means of control in the Soviet bloc, a lot of the Eastern countries. What do you think? Do you think it'll become mandatory in Australia? Do you think the state should make it mandatory? Or should people have the right to choose? Let me know your thoughts and opinions in the comments below. I guarantee this video is going to be demonetized by YouTube. But it's an important thing to discuss. And will this affect, if you're a LNP supporter, will you still vote for good old Scomo? And do you think Labour would be any different? As always, thanks for watching. Please like, share and subscribe to the channel. Let me know your thoughts and opinions down below. If you're a fan and want to support the content I create here, there are a few ways you can. You can join the channel here on YouTube. You can support us using our affiliate links at Amazon, eBay, Independent Reserve or Kucoin. You can buy merch from HeiseSays, use Gold Pass from the Perth Mint, or support us via PayPal. Take care, have a great day. I will see you all next time. Bye for now.